Jen, so I've just had a good look at your brain scan, and obviously I had a good look at you earlier. Now I think you're having a stroke. Looking at you, that left side really isn't working very well now, is it? Your arm is quite weak and your leg is very weak. You can hardly move it and you wouldn't be able to stand and walk on it at the moment. So I think we need to give you some treatment to see if we can help this. So I've got a treatment that we call a clot busting treatment that I want to give to you. We give it as an injection and then a drip that goes on over an hour. And I want to show you what potential benefit that has, but I think we should go ahead and give you this treatment. So this picture is showing you what would happen if we gave 100 people who were having a stroke this treatment. We gave it to them within 3 hours of onset of the treatment, and you've come to me in really good time, and how they would be at the end of 3 months. So if you look at this picture, all the little people who've got no colour on them, actually the treatment makes no difference to them at all. The people who are green, and that's about 1/3 of the people, are actually better than they would have been if they didn't have the treatment. And then the people who are dark green, which is somewhere between 10 and 12% of people, make a really good recovery so that you wouldn't really know that anything had happened to them. Now, offset against that, because this treatment dissolves clots, it can cause some bleeding. And the thing we worry about most with it is if it causes bleeding in the brain. And of those 100 people, 6 of them, these ones down the bottom, would have some bleeding in the brain. And by 3 months, 3 people would be worse than they would have been without the treatment. And 1 or 2 of them might actually die as a result of the treatment. But overall, looking at you and looking at how this is affecting you, I really think this is a treatment we should give you, because as you can see, we would be helping 1/3 of people and making some people completely better, albeit there is a very small risk of harm from the treatment. How does that sound to you? Is there anything you want to ask me about that?
If I didn't have the treatment, I would be less likely to improve.
So this gives you your best chance of improvement. Okay. This is compared to no treatment, that we will have 1/3 of people better than they would have been.
Okay.
Obviously what I can't tell is what exactly will happen to you, but you've come to me in good time. Your brain scan looks very suitable for the treatment. Your blood pressure is very good. So I've got no particular reason to think you are at increased risk of a worse outcome. And the fact you've come to me in really good time suggests to me that you're in a group that may well benefit from this treatment.
Okay, I'd like the treatment.
Okay, well let's go ahead and get that sorted for you as soon as possible.